Ucher discovered the larval forms of Ucheria, while Dr. Bancroft he discovered the mature filarial worm and was one of the first ones to suggest that it was born by a mosquito. It is transmitted by mosquito. It has been suggested by Dr. Bancroft, and that is why the the parasite name has been given Wuchereria bancrofti. Then Brugia malay has been named after its discoverer, the parasitologist of Dutch origin, Lambert Brugge. Now, the morphological features you can see here, the same thing. The males are shorter than that of the females due to the elaborate development of the ovary. So, male and female parasites are given, shown in the picture in the slide. The males you can easily differentiate owing to the presence of the copulatory spicules, and the same is absent in the female. The female have anus, whereas the males have the cloaca, which serves the opening for the gametes as well as the undigested food. So Uchere bancrofti, it is a pseudocoelomate. That means no true coelom is present, no true cavity is present. It is of course cylindrical, it is thread-like, it is creamy white nematode which looks transparent. That means it is completely transparent, and body is of course slightly curved with rounded ends and is covered with a thick cuticle with syncytial epidermis. Syncytial epidermis means there are numerous nucleus is present. So numerous nuclei are dispersed throughout the body cavity, which appear as dark spots when it is stained. The mouth is very small and is devoid of buccal capsule, as you have seen in Ancylostoma duodenale. Male and female Bancrofti are separate and exhibit distinct sexual dimorphism. You can easily, simply by observing, you can bring about the differences between morphological differences, anatomical differences between the male and the female Wucheria bancrofti. The cephalic end, which is also called the head end of the adult worms, is slightly enlarged and terminates in a roundish swelling. Now, the morphology, they are very long, transparent, they are cylindrical, tapering at both ends. Sexes are separate, female is larger than the male. Posterior end of the female is narrow and pointed. It bears anus. That of the male is curved vertically and contains genital papilla, two copulatory spicules of unequal length. Males and females remain coiled together, usually in the abdominal and inguinal lymphatics. So this is very important. They remain coiled together, usually in the abdominal and inguinal lymphatics. Inguinal lymphatics means just around the scrotal region of the males and in the testicular tissues. That is why they infect such regions, leading to the development of hydrocele or the inflammation of the inguinal canal. The head end is slightly enlarged, mouth parts simple without lips, no lips you find. Pharynx is divisible. You have the anterior muscular portion, which is required to obtain the food, and a posterior glandular portion. An esophageal bulb is lacking. The intestine is very simple. It is straight. The female is viviparous. Remember, they are viviparous. They give birth to young ones and directly liberates sheath micro. So we should say it is ovoviviparous. They develop ovum which become fertilized, and the fertilized, they are not laid outside. They remain within the body, and within the after incubation within the body, they hatch within the female body, and the life form of the larvae, they come out, they are given birth to. So ovoviviparous are directly liberates sheathed microphylla. What is sheath? That means it's covered by a covering into the lymph, because they reside in the lymph. Adult worms live for many years, probably 10 to 15 years. So here the morphology, you can see syncytial epidermis. You can find the numerous nuclei are present here, the nerve ring, and the covering, the sheath covering, that is a stylet, And so this is the anterior end where you find the stylet. They serve for the entry into the host body, and it is called the cephalic space. And here in the posterior region you can find the genital cells, which are responsible for the development of the uh, gonads. And tail, no nuclei in the tip. Then the next important stage is the microfilaria. Microfilaria is the larval stage of Wucheria bancrofti. The microfilaria are characterized by colorless translucent body. Now, transparent and translucent are two different. Transparent means the light can easily pass through. Translucent means light will pass through, but not completely. There is a blunt head and a pointed tail. Their length is of 250 to 300 uh, micrometer. They are covered by a sheath, and within the sheath, ଯେମିତି ଗୋଟେ ଜରି ପ୍ୟାକେଟରେ, they are capable to move. So the sheath is larger than the microfilarial larva itself, and allowing the microfilaria to move actively forward and backwards within the sheath. So this hyaline sheath is followed by a cuticula being lined by flattened subcuticular cells or epidermis and an inner column. These are the different structures of the microfilaria. You have a somatic cell or nuclei. They appear as granules in the central axis of the body, extended from head to tail. In our next slide, you can see their head end has a clear space devoid of granules known as the cephalic space. Now, important structures from the anterior end downwards for the microfilaria are future mouth or oral stylet, nerve ring, oblique area or devoid of granules, nephridiopore. All these things are present. Microvilli do not multiply or develop further within the human body because they have to be taken by a cold-blooded invertebrate, that is a mosquito. If they are not ingested by the female mosquito, they typically die within 2 to 3 months within the host body. So their fate lies on the fact whether they are taken up by the female mosquito or not. For effective transmission, a microfilarial density of at least 15 per drop of blood is necessary. So here, this 15 per drop means in one drop of blood, there should be at least 15 microfilaria. Then only there is a chance for transmission or entry into the female mosquito. Now, the structure of the microfilaria is given. The lifespan in the human body is probably 70 days. Within the 70 days, it has to find its entry into the Anopheles into the female mosquito. The microfilaria circulate in the bloodstream, and they show a peculiar phenomenon called nocturnal periodicity. What is nocturnal periodicity? It is the behavior shown by the microfilaria to light. They are being seen in large numbers in the peripheral blood only. What is peripheral? They come into the circulation just beneath the skin. So that is called peripheral circulation during the night hours between 10 p.m. and 4 a.m. So when and during the daytime, they move into the deep blood vessel. So they disappear inside during the rest of the day. Inside means deep blood vessel. It is believed that during the daytime they retire inside the deeper blood vessel. This correlates, this habit, this behavior, it correlates with the phenomenon of night biting habit of the vector of the mosquito. So Culex mosquito, almost all mosquito, they have the biting habit during the night hours, and this uh, ability, this behavior, that is nocturnal periodicity, renders them a greater chance to be taken up by the female Culex mosquito. So all the structures which we have described here, this is the structure of the microfilaria, and you can see this part is the actual body, and the covering this cuticular body sheath is covers the animal loosely so that the animal can move forward and backward. Now, life cycle coming. So this is a stained form of the microfilaria. Okay, stained form of the microfilaria. You can see here the sheath, which is loosely present, and the actual animal body. They are present within this loosely covered or covering of the sheath, where the movement of this larva anterior and posterior is possible. So life cycle, they have it. It is a digenetic parasite. Definitive host is definitely human being because it does not affect any other animal. And the intermediate host, why we say intermediate host? Because it is transmitted from human to human through a Culex mosquito, female Culex mosquito. So Culex mosquito, it is called the intermediate host. But some, it is believed that other species also, that is Aedes, Anopheles, they can also act as the secondary host and can transmit the Ucheria or intermediate. The disease is transmitted by Culex mosquito in urban and semi-urban areas of tropical countries, by Anopheles in rural areas of tropical countries, and by Aedes in endemic island of the Pacific. In India, Culex papiens fatigans is the principal intermediate host. So definitely in Indian context, we will always write that the intermediate host is Culex female Culex mosquito, that is Culex papiens, fatigans, and in other country, they it is the work of the intermediate host is carried out by some other species, that is Aedes and Anopheles. Now, what is the infective form? The infective form means the stage at which it can infect a healthy individual. That is called the infect. So, infective form is the filariform larva, and it is the third stage of larva, L3. It is considered as the infective stage for human being. Now, what is the transmission process? Human being acquire the infection through the bite of a mosquito, and that carries the filarial larva. Now, life cycle, the development in humans, first of all, so when uh, the human lymph vessel, they contain both male and female adult Ucheria bancrofti. They reside in the coil form within the lymphatics. They copulate with each other. Copulation takes place within the lymph glands or the lymph vessels of the human being, and the females are definitely ovoviviparous. Instead of laying eggs, they don't lay eggs. The eggs are retained within the body. They liberate numerous active embryos called the juveniles. That is why we call it as a ovoviviparous or microfilaria in the lymphatic channels. These microfilaria quickly move from the lymph vessel to the main lymphatic trunks. As you know, in case of blood vessel, the capillaries, they associate with each other to form the um, smaller arterioles. Then these arterioles unite to form the artery. The artery will unite to form the larger artery, and so on. See, in the same manner, the lymph vessels, they also unite with each other to form the main lymphatic trunks and gradually enter the circulating blood. How they enter from lymphatic to circulating blood? As I have told you in my first class, that uh, the lymph originates from the blood, and it is a continuous process. So if we don't allow the lymph to be emptied into the blood, our volume of blood will go on decreasing. So it is a continuous phenomenon. Blood gives rise to the lymph. The lymph gets separated from the blood. Actually, blood minus RBC and certain protein is equal to lymph. So these lymphs, uh, they are again carried by certain vessel called the lymph vessel, and these vessels, they empty their content into the major blood vessel. So the total volume of the fluid portion of our body is maintained constant. Ultimately, microfilaria, they migrate to the deeper blood vessel and stay there for further development. So from lymphatic vessel they have entered the blood vessel, and in the blood vessel they will remain for some time for further development, because in immediately they cannot be, even if they are taken up by the mosquito, they will not be infective. So since microvilli reside in the deeper blood vessel, they cannot be sucked by the mosquito. So it has to come to the superficial layer of the skin, so that the mosquito, by its habit, its behavior, it will suck the blood from the host body, and along with the blood, the microvilli will enter. Culex pipes fatigans is a nocturnal feeder. Every all We believe that all mosquito are nocturnal feeder. Therefore, they move to superficial peripheral vessels at night, um, between 10 p.m. to 4 a.m. in order to be sucked by the mosquito. That is a peculiar host parasite relationship. It is exhibited by the larval stage of Wucheria bancrofti. Whereas during daytime, the microvilli you don't find. They reside in the larger, deeper blood vessel, and during daytime there is no need to come to the surface, because the mosquito rarely, seldom they bite. They are active during the daytime. Now, they are present in the blood vessels of all the organs. It may be lungs, it may be kidney, heart, and large arteries. This is the nocturnal periodicity of the larvae. Now, in the mosquito, when the microfilaria, after in its appropriate time, they are sucked by the culex adult females along with the blood. They reach the stomach of the mosquito. In the stomach, they lose their outer covering. তার যে ঘোড়নি রয়েছে, the covering রয়েছে, sheath রয়েছে, it is lost. It is taken out, and they penetrate the wall of the stomach of the mosquito within 1 to 2 hours. From there, they migrate to the thoracic or wing muscles, where they will develop further. Wing muscles re ଆଉ thoracic muscles re ସେମାନେ ପଳେଇ ଯାଆନ୍ତି. The life cycle passes through 3 larval stages in 2 weeks. So after its entry into the mosquito, it has to develop further through 2 moltings and 3 larval stages, which is completed roughly within 14 days or 2 weeks. First stage larva, it develops in the next 2 days, which is, uh, of course, 124 to 250 micrometer long. And the second, in the next 3 to 7 days, it thickens further, enlarges, and metamorphoses into second stage larva. The second stage larva is, of course, elongated and with a increased diameter or breadth. It enters the third stage of development in the 10th to 11th day of their hatching. So all these things, that 10 to 11th day means 10 to 11th day of their hatching, of the entry into the mosquito body. That is, so third stage enlarges almost 5 times to that of the second stage. So in each stage, there is an elongation, there is an enlargement of the body, and ultimately it reaches around 1,500 to 2,000 micrometer in length. The spiky tail degenerates, while various organs which were in a underdeveloped condition, they develop completely. Body cavity develops, and in about 14th day, it migrates to the proboscis of the mosquito, waiting uh, to be released during the fresh biting of the mosquito to the healthy human individual. It cannot develop further in the mosquito. This microfilaria, they cannot develop inside the mosquito, as it needs higher temperature. So some development should occur in the lower body temperature, and some development occurs in the higher body temperature, which is provided by the human host for maturation into adult. The third stage larva is infective to the man and can only develop in human host, because it provides the ambient medium for the complete development. Now here there is a schematic diagram we can see here. This is the pool of blood. The proboscis is pierced into the through the skin. It ingests the microfilaria. It moves into the stomach. Inside the stomach, some development takes place, and then they move into the thoracic. This is the thorax, okay? This is the head. So some develop, they move into the thorax or the wing muscles, and some development here occurs. That is the uh, development up to the third larval stage, and then after maturation, they will enter into the salivary glands, which is present in the head region, and ready to be infected. So female Culex mosquito releases the third stage larva of the human skin near the site of puncture. Remember, totally it is not injected like you inject medicine through the injection system. Though it will just liberate at the surface of the punctured skin. जो ଜାଗାରେ ସେ ଚୁଣ୍ଡ ଫୁଟେଇଥିବ ସେଇ ଜାଗାରେ ସେ ରିଲିଜ କରିଦବ in the on the skin. So it will release the third stage larva of the human skin near the site of puncture. Puncture means where it has pierced. The larvae get attracted, ତାପରେ larva ନିଜେ ନିଜେ ସେ skin ଭିତରକୁ ଯିବ ସେଇ punctured area, because it is oriented by the warmth of the human body, the temperature of the human body, and they will invade the skin either through the puncture or on their own. So preferably they use the punctured region, or if the it is available in a region where there is a cut, so it can enter through that region also. So it has to be placed near the near the cut region or the punctured region, to be taken out, to move into the human body. They migrate through the subcutaneous tissue, reach the lymphatic vessel, and accumulate at a particular lymphatic region, especially inguinal, scrotal, and abdominal lymphatics. ସେ ରିଜନରେ ସେମାନେ ଏକତ୍ରିତ ହେଇଯାନ୍ତି, ସେମାନେ ଜମି ଯାଆନ୍ତି। ଏଇଠି ଲାର୍ଭେ ଗୁଡ଼ିକ, here the larvae, they pass through two molds, ଆଉ ଦିଟା molting ହବ, and grow into mature adults after approximately 5 to 18 months. So remember, after the entry, months together passes before they become matured into adult, and simultaneously the male and female will copulate, and they will start releasing their microfilaria into the blood to be taken, to transmit to other human beings by through the agent of the Culex mosquito. So complete life cycle has been shown here. You can see the different stages. The number one, mosquito takes a blood meal here. Mosquito takes a blood meal here, and then after when it takes the blood meal, it releases the microfilaria at the region of the punctured region on the skin. The microfilaria are attracted by the host blood, which is warm body temperature, and in each bite, at least both the sexes of the microfilaria are present, and this enter into the lymphatics, where they become adult and aggregate in particular region, that is the groin region or the inguinal region of the abdomen or the scrotal region, and they multiply, they copulate to give rise to the microfilaria, which is called sheathed animal, sheathed larva. Sheath means the larva is enclosed by a covering, transparent covering, which is outfitting. Outfitting means it loosely covers, so to allow the movement of the microfilaria within the sheath condition. Now, see, in this stage, when the mosquito, when it, and during the night time, when the mosquito bites the body, the microfilaria enters into the body of the mosquito, and here they change their structure. They, from the uh, larva one, they pass through the mold, they develop larva 3, and ultimately they reach the thoracic muscles, and finally into the salivary glands of the mosquito to be transmitted to a fresh human being. Now, epidemiology, uh, the prevalence of these diseases in different countries. So in India, you have the filariasis caused by Wucheria bancrofti, Malay is very rare in India also, and Timori is present only in case of Indonesia, the Timor's island of Indonesia. That is why, specifically, it is named as um, uh, Timori, Brugge Timori. Um, then the larval filaria affects over 120 million people in 73 countries. In India, these are the including the state, Odisha state, Kerala, all these states are equally infected. The transmission from person to person occurs through the bites of the mosquito agent and the larva which bites at night. Infected larva, they are deposited at the site, the punctured site of the skin, and simply the larva, it makes its own attempt to get entry into the skin, being attracted by the warmth of the body, and from the skin blood vessel they will simply head towards the lymphatic system through the capillaries. Now, who is at risk for infection? The person, of course, who are at a greater risk of mosquito bite. So, repeated mosquito bite over several months or years, because at any time, suppose a infested region, if the mosquito bites, so you cannot ascertain that the mosquito always contain microfilaria in their salivary gland. Of course, if it contains microfilaria, it may not be that the microfilaria have already become matured enough to go into the infective stage. So repeated bite must be there for a person to exhibit the clinical symptoms of filariasis. People in tropical and subtropical area disease is common. They are at greater risk of infection. Short-term tourists to this endemic region are also at higher risk of being infected with filariasis. Now, incubation period is generally microfilaria 10 to 14 days. So, time interval for microfilaria is to develop inside the mosquito to third stage, that is in. So after entry into the mosquito and its maturation into the infective stage is 10 to 14 days, and it is called the incubation period. Pre-patent, it is a time interval between the introduction of the infective larva, যেতବେଳେ মহিষকো, when the mosquito bites the human being and liberates the first appearance of detectable microvilli in peripheral blood, it is 12 to 18 months. That means this is the time they require to become adult, and they copulate and they release the microfilaria into the lymphatic system, which ultimately come to lie beneath the skin or the peripheral circulation. Now, clinical incubation period, it is the time interval from invasion of infective larvae to development of clinical manifest. That means clinical symptoms are observed. So it is generally 8 to 16 months. Now, pathogenicity, it is caused by the adult worm, actually, because they block the lymph vessels and blocking blocking of the lymph vessel results in the accumulation of fluid in that particular region that are responsible for the swelling of different parts of the body. They may cause elephantiasis, lymphedema, lymphangitis. Occult filariasis, it is caused by microfilaria or embryos. And occult filariasis means eosinophilia. Eosinophilia is a condition, not only this microfilaria or Wucheria bancrofti, because a rise in eosinophil count in the blood DC count, differential counting, when there is a rise in eosinophil, it implies that the person is suffering from some sort of infection. So one may be this suffering infection by the microfilaria. So there is a asymptomatic stage, means when the person suffering, they do not show any symptom. It is asymptomatic. It is characterized by presence of microfilaria in peripheral blood. No clinical symptoms or signs of the disease is observed. Nothing. They just behave normally. Some infected person remains asymptomatic for years together, or some instances in life. Others lead to acute and chronic stages, and they exhibit swelling of the limbs or swelling of the scrotal region, swelling of the inguinal region. Acute stage starts when they have already manifestation like lymphangitis, lymphadenitis, and filarial fever. They also suffer from fever along with the infection or inflammation of the lymph nodes and the lymphatic system. In some cases, male genitalia is affected. Male genitalia means the scrotum is affected, leading to funiculitis, epididymitis, and orchitis. Okay, orchitis. So all these orchitis, epididymitis, funiculitis, all are responsible for the inflammation of certain parts of the scrotum. And suppose inflammation of the epididymis, where the sperms are stored, it is called epididymis. So uh, um, all this is attributed to the swelling of the scrotum. Also result in headache, nausea, and urticaria. Lymphangitis, it is the inflammation or infection of the lymphatic vessel, as I have already told you. And lymph node infection, it is called lymphadenitis. Filarial fever, high fever of sudden onset leading to 2 3 days with temperature 103 to 104 degree. Um, Temperature normally comes down with profuse sweating associated with the local symptoms of inflammation of the lymphatic vessels. So here in the this lympha denitis, you can see here the lymph nodes have been infected in the neck region. Okay, in the human, this is the neck region. The lymph nodes are, and they show that it is infected, swelling, redness of this. Now, blood examination, transient leukocytosis, increased neutrophils, and presence of microfilia, they are also can be. Now, chronic stage develops 10 to 15 years from onset of first attack. 15 years per year. So after this 10 to 15 years, so the enlargement of the or deposition of the fluid inside the scrotum leads to hydrocele, then lymphedema, elephantiasis, chyluria. Chyluria means the mm, uh, urine becomes milky in nature. Okay, urine becomes milky in nature. So uh, clear and straw colored, sometimes milky, cloudy, or hemo. So accumulation of fluid occurs as a result of obstruction of the lymph vessel of spermatic cord, and also due to exudation from inflamed testis and epididymis. Exudation means the release of certain fluid from this inflamed. That means attacked testis as well as the epididymis. Then occasionally hydrocele on enormous amount with elephantiasis of scrotum, fluid film filled balloon-like enlargement of the sac, that is scrotal sac. They become laden with the fluid, which leads to the enlargement with pain, lymphedema, abnormal accumulation of lymph in tissues causing swelling of the arms, the breast, and or the genitalia. Also, they show swelling caused by fluid collection because of improper functioning of the lymph node. Now, elephantiasis is caused by mechanical blocking of the lumen of lymph vessels, and this blocking leads to fibrosis of the lymph vessel. Commonly, it affects the limbs, the genitals. Disabling and disfiguring also occurs. ঠিক ଭାବରେ ଦେଖାଯାଏ disfiguring ମାନେ ବଢିଯିବ, ଗୋଟେ ଗୋଡ ସାନ ହେଇଯିବ. And same thing in case of the breast and the skin also, disfiguring. It causes hardening and thickening of the skin, swelling and decreasing function of the lymph system, decrease. So when they block, there is a decrease of blood flow due to worms inside the blood vessels. Heart failure chances are there, breathing difficulty, eosinophilia, and kidney damage. So when there is a rise in eosinophilia, there is, it leads to some complications. So foremost thing is that the eosinophilia count should be brought to normal by giving prednisolone or the steroids. Now, chyluria, as I've told you, due to rupture of varicose chyle vessels. Now, varicose blood vessels, varicose vein, there are, these are um, ଦେଖିଥିବ ଯେ sometimes prominent blood vessels ଗୁଡ଼ିକ skin ରେ ଦେଖାଯାଏ. with elevated, that is called varicose vessels. Similarly, varicose chyle vessels, chyle term ଟା ମନେ ଥିବ ଯୋଉ fat digestion ପରେ fat absorption ଯେତେବେଳେ ହେଉଛି ତାକୁ chyle କୁହାଯାଉଛି ଯୋଉ digestion, food digestion ହେଇଗଲା ପରେ chyle vessels through mucous membrane of urinary tract. So lymph fluid they passes into the urine and it appears milky white in color due to the presence of chyle or the milky milky white type of product. When it is present in the urine, it is called chyluria. It appears white in color and contains fat particles, uh, albumin, fibrinogen. Then dilation of the lymph vessel, lymphagovarix, dilation of lymph vessels in the vaginal, scrotal, and abdominal regions. Dilation is caused due to accumulation of these adult parasite inside the. So lymphorrhagia, rupture of lymph vessels, result in release of lymph and chyle. Occult filariasis, it is called Mears-Koenar syndrome, and the clinical conditions not due to lymphatic involvement but due to hypersensitivity reaction to filarial antigens. So the filaria one, they liberate certain antigens into the body, and the body's response to these antigens released by the filarial presence of the filarium uh, results in the occult filariasis. It is uh, characterized by lymph node enlargement, hepatosplenomegaly, pulmonary symptoms, and absence of microfilaria in blood. So, tropical pulmonary eosinophilia, here low fever, weight loss, cough with scanty sputum, hepatosplenomegaly, that means enlargement of the liver, enlargement of the spleen, the serum antibody load of immunoglobulin E and anti-filarial antibody level will rise. Response well to treatment. If not treated, progressive pulmonary damage occurs. So we have to treat. So with different drugs. Otherwise, the um, pulmonary damage will progress and it may lead to death. Eosinophil count in the peripheral blood exceeds 450 per uh, microliter, but in usual condition less than 7% in circular. So generally the count rises. We denote the eosinophil count as in percentage. So it always go beyond 14, 12 to 14% or 16%. So here the lymphagovarix, that is the slight swelling in the lower extremity of the body, which involves the varicose uh, lymphs. So yeah, varicose limbs এই ପ୍ରକାରର ଯଦି blood vessel ତାକୁ କୁହାଯାଏ varicose arteries, okay, varicose blood vessels. So here one limb has been expanded, or it assumes it gives the uh, structure of a elephant limb, that is called elephantiasis. Same thing, edema in legs due to accumulation of the lymph. Both the legs has been infected. Here also the lymphatic filariasis, enlarged lymph here. So the scrotum has been enlarged. Here you can see the left palm. You can see five fingers are there. 1, 2, 3, 4, and this 5. So you can see the disproportionate size and the structure of the uh, facial structure. So diagnosis can be done taking blood during the night hours. So when you take a blood sample, don't switch on the light. So if you switch on the light, they will go into the deep blood vessel, and the you will not find the parasite in the sample blood. So collect blood specimen from 8 p.m. to 4 a.m. and it should be thick smear. Stain it with GMSA. So the positive result will be indicated depending upon the parasite load in the person suffering. Okay. So microscopic examination to find the microfilaria, and antigen detection ELISA test ରେ ଆମେ ଜାଣିପାରିବା whether the antigen is present. Simply diagnosis can be taken by taking into consideration of the chylous urine or chyluria, the fluid is taken for examination under the microscope. Lymph exudates, lymph fluid are taken out, or hydrocele fluid is taken out and studied. Lymph node biopsy is taken, X-ray, ultrasonography to locate the moving filarial worm in the blood vessel. So they produce certain sounds also. We can come to the conclusion. So diagnosis, direct wet mount, then blood smear, DEC provocation test using concentration of blood, intradermal test. For intradermal test mane the antigen testing ame janipariba, antigen antibody detection. So these are the different method of diagnosis. Treatment, generally DEC, diethyl carbamazine is given. DEC tablet gudiko choto pilanku diya jauchi, and ମୋଟା ଯାଉଛି ସିଙ୍ଗଲ ଡେରେ, ଗୋଟେ particular ଡେରେ ତାଙ୍କୁ ଫିଡିଂ କରାଦିଆଯାଉଛି to eliminate these filariasis. So ivermectin, generally ivermectin is given to uh, as a single oral dose, and combination of the two also gives a better result. So commercially Diker and all these may. Then treatment, rest antibiotics, antifungal, physiotherapy. Bandaging physiotherapy means you have to do certain exercises. Then prevention and control, of course, all these things which you prevent. Don't allow the mosquito to bite. So where the mosquito larvae gets collected, you liberate the gambusia larvivorous fish. They will kill the larvae, and if the larvae are killed, there will no. So insecticide spraying can also control. Um, just remove the bushy area, which are the uh, region where they uh, hide during the daytime. So don't allow the bushy region to grow surrounding your uh, home or house, and don't allow any utensil or ignored object which will collect water and will favor a breeding place for the mosquito. uh, Treatment, as I've told you, ivermectin, surgical treatment also. Small lymphatics are anatomized to larger central vein, produced marked reduction in lymph size. So you cannot completely uh, bring it to its normal condition. So general treatment, rest, antibiotics. Then next, our next one. Just a minute, let me. So Dracunculus medinensis, it is called Guinea worm. It's a very, it is a subcutaneous parasite. Okay, subcutaneous parasite. We have just studied the about the lymphatic parasite. This is a subcutaneous parasite. They remain in the subcutaneous region of the skin, just beneath the skin. The most important is Dracunculus medinensis, and it is transmitted by zooplankton. Is a copepod that is called the cyclops. Okay, cyclops. They are the carriers of this nematode. It is a nematode, definitely. It causes dracunculiasis, commonly called guinea worm disease, GWD. So it is transmitted by drinking water contaminated with copepods, that is cyclop, and it is a very this disease causes a painful skin blister. So skin blister means some eruption occurs, and this eruption burst, liberating the fluid, and generally ସେଇ ଯୋଉ fluid ସେ ଯୋଉ କଣା ହେଇଯାଇଥିବ ସେଇ ବାଟ ଦେଇ ତାର embryo ଗୁଡିକ release ହେଇଯାଏ, and this embryo when it is released, only when you wade through the water, the release ହେଇଗଲା ପରେ it is taken up by the cyclop, which are the planktons present in the contaminated water. So cyclop ରେ କିଛି ହେଇଗଲା, when you drink this cyclop contaminated water, it is infects your body. So with just 27 human cases reported into 2020, dracunculiasis is a serious parasitic disease on the verge of eradication. on the verge of eradication. Dracunculosis is seldom fatal. It is not fatal, so that is why it has not need attracted any attention by the parasitologist. So patients are rendered unable to function for weeks or months. It is seldom fatal, no death. The humans get dracunculus infection only when they swallow infective larva containing cyclops. As I told you, these are copepods present in the stagnant drinking water. The disease has been reported in all age groups. So there is no one that, or sex, it does not determine. So all age groups, though more commonly among 15 to 45 years old people. The type of work done by these people, especially those are working away from home and are in close contact with water, they are prone to these disease such as farmers, herders. Herders means who carry the herd of the cattles, herders, and those fetching drinking water for the household.
Sir, please share all the PPTs in the group.
I am not included in the group, okay?
Sir, I think we have admins in the class. They will, if they will
Okay,
join you.
okay, you request them. I'll share it, and for your kind information, in the ectoparasite, I'll prepare it for the sharing today only. If I am added, I will share these slides to all of you. Okay.
Okay, sir. Okay, sir.
Now you see this guinea worm. You see the that is the opening. Blister has burst. এটি ফাটি যাইছি blisterটা, and simply these animals they don't come out in this condition. Actually, when the blister, the animal remains within the body, only the larva comes out, okay, outside. But if the person is identified that it is one is suffering from dracunculiasis or guinea worm, simply the hole is identified, and with a fine forceps it is just taken out slowly. So generally you just don't take out instantly, it will not come out. Simply it is tied with a stick, and the stick is rolled gradually every day, so it gets loosened, and it takes several days for the complete removal of this guinea worm from the body. So generally the source occur in the lower limbs of the human body. Now characteristics of this dracunculus, the parasite that is the most common is medinensis. It lives in the subcutaneous tissue of human, dog, cattle. All other animals are also infected. And carnivores. It is caused by the female worm, which is assigned the term Dracontiasis by Galen. It is the only helminth parasite that is transmitted purely by drinking water, which contains copepod, the bearer, the bearer of this parasite. So, female guinea worm measures 600 to 1000 millimeter in, so almost 10 centimeter. Uh, in length, and is it is 1000 millimeter means how many centimeter? 10 centimeter, I think. Then it is 2 millimeter wide, so it is very lengthy. While male guinea worm is much smaller than the female. It is true for all the nematode parasite. The males are smaller than that of the female. The males die after copulation. Okay. So whatever, suppose if you remove a dracunculus from a host body, it is definitely a female because the male has already died, and the length of this parasite indicates that it is a female. So males die after copulation. The female worm is milky white in color, as I told you in my earlier slide, and a tapering recurved tail and a blunt anterior end. It is ovoviviparous, and the gravid female's body is practically packed with branches of massive uterus carrying 3 million embryos, and they remove these embryos, they shed these embryos into the nearby water medium every uh, 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 every every few days. Females have a 1 year life expectancy while males have a 6 month life expectancy, but after the copulation between the male and the female, the male dies. The larva that comes out of the egg, it's called a rhabditoid. It measures around 750 micrometer in length and possesses a wide anterior end and a thin thread-like tail. So yes, here this is the cyclope. Uh, you can collect water and concentrate the water, and definitely from the pond water. Generally you will find that in the stagnant pond water you'll get the large number of cyclopes. So this is a typical cyclope. It is a arthropod, belongs to phylum Arthropoda. It is a copepod and a plankton, zooplankton. And this is the dracunculus. Okay, this is the dracunculus embryo that will be liberated into the water to be taken by this cyclope. So embryo, they are embryonic larva, and anterior end is rounded, tail is pointed. You can see the pointed tail here, and this is the anterior end. This is the anterior end. This is the tail pointed. The tails look coiled bodies in wet preparation. The cuticle shows prominent striations. The larva swims about with a coiling and uncoiling motion. So now, life cycle of this definitive host is man along with other vertebrate animals. So wild animals, felis are there, canines are there. Intermediate host is mesocyclope. Okay, Leucati, mesocyclope. Generally, we say it call it as a cyclope. It is a freshwater microcrustacean copepod. And humans get infection by drinking contaminated water which contains this infected copepod. These contain stage 3 larva, L3 larva, which are released into the human body. So copepod ভিতরে जो larval stage রয়েছে in the L3, and this L3 is released when we drink contaminated water. Along with the water, we take a copepod. So the larvae which comes out, um, they penetrate the duodenal wall and enter the retroperitoneal connective tissue where they develop into mature adult male and females. Okay. Female migrate to the host skin, causing severe discomfort and impairment. Females are found in the subcutaneous tissue of human being. Majority of infection affect the lower extremities actually. So here also you can say the if it is present in the lower extremities when you move into the water medium, immediately it causes the blister to burst immediately. ପାଣିକୁ ଭିତରୁ ଗଲେ ମାନେ ବ୍ଲିଷ୍ଟର ଯୋଉମାନଙ୍କର ହେଇଛି ସେଟା ଫାଟିଯିବ and it will liberate the larvae. So, such as ankles, legs, although they can also affect other areas of the body. Adult worm undergo copulation, after which male die and get calcified. So, male ଟା ତା ଭିତରେ ରହିଥିବା ଅବସ୍ଥାରେ calcified ହେଇଯିବ. Calcified means it is deposited with calcium for around 6 months, after which they gradually disintegrate ହେଇଯିବ. ମନକୁ ମନ disintegrate ହେଇଯିବ. Female migrates to the extremities of the body which have more chance to be in touch with water. The female the extremities of the body, that means lower limb, ସେଠିକି ପଳେଇଯିବେ and they will um, give the rise of a blister because lower extremities or lower limbs have a greater chance to be exposed to the water whenever we move into a water body. Now you can see here the limb, and this is the blister. A blister ফাটি ଯାଇଛି, and these are the fluid come out. The fluid ସହିତ the embryos will also, the larva L3 stage will come out to be taken up by the cyclope. So clear blister ଗୁଡ଼ିକ ଏଠି lower extremity ରେ ଦେଖାଯାଉଛି ଏଠି. Almost a year after the infection, the internal pressure leads to the rupture of parasite's body wall and uterus, forcing numerous larvae to be expelled. Along with the larvae, a toxin is also released, which causes a strong allergic reaction in the host, resulting in the formation of a skin blister. So, Almost a year after the infection, internal pressure leads the rupture of the parasite body wall and uterus. ତା ଭିତରେ ଯୋଉ parasite body wall, internal pressure means host body pressure. It ruptures the parasite body, forcing numerous larvae to be expelled. ତା ସହିତ toxin is also released, and this toxin causes the appearance of a blister ତାପରେ rupture ହେଇଯିବ, and an ulcer is formed with a minute pore. Blister rupture ହେଇଗଲା ପରେ minute pore through which active embryos in their first larval stage, they are released when come in contact with water. Active embryos means the embryos, when they are exposed to water medium, they simply come out of the body into the water. That is why we say it is active embryos. Then, if there is copepod, then this copepod crustacean, it will ingest these larvae in order to for further development in the copepod body. Has these only survive for 3 days. Say 3 दिन भीतर यदि if they are not taken by the copepod, they will simply disintegrate and die. Larvae enter the intestine of the copepods and penetrate the gut to reach the hemocoel. That means the ଏଠି ଇନସେକ୍ଟରେ ସବୁ ଇନସେକ୍ଟରେ ହେମୋସିଲ୍ ହଉଛି ତାର the fluid. All insects have hemocoel. That means the cavity which contains blood-like fluid, which may be which may be pigmented or non-pigmented. If it is contain, if colorless blood which does not contain the metals which impart color, so here they molt twice inside the hemocoel and become infective stage of L3 or the third larval stage within 10 to 20 days after their entry into the cyclop body. The normal lifespan of the cyclope is around 90 to 120 days. However, it can survive only for 40 to 45 if it is infected, and dies in just 15 days if severely infected. ଯଦି severely infected ହେଇଯିବ ସେମାନେ ମରିଯାଆନ୍ତି, but generally they live for 90 to 120 days. So humans swallow the number of infected copepods with drinking water and acquire the infection. Gastric juices digest the copepod को digest करदबा, तापरे larva ଉପରେ କିଛି ତାର ପ୍ରଭାବ ପଡିବନି. Our gastric juice present in the liberated in the stomach, and the larvae are released. These larvae penetrate the duodenum, cross the abdominal mesenteries, and somehow reach the subcutaneous connective tissue, where they move to the axillary and inguinal areas. About 20 days after infection, they undergo third molt, followed by the final one to become the adult condition to continue this cycle. Now, pathogenicity ହେଉଛି କ'ଣ? ଯୋଉ blister ହବ, blister open ହେଇଗଲା ପରେ it will provide a medium for the secondary infection by different bacteria or other protozoans. So it causes fever, nausea, vomiting, diarrhea. Itchy rashes means kude over feeling of to each. The blister formed by the allergic reaction of the toxin. So toxin which is released after the rupture of the female body releases the toxin that is it causes the formation of the blister in the lower extremity of the body. It is released, the toxin is released by the female because there is no male. Adults causes a female adults, this toxin substance causes a burning pain. ପୋଡ଼ିଲା ଭଳି ଲାଗିବ. Without adequate care, the wound gets bacterial. So ତାକୁ କୁହାଯାଏ secondary infection. ଯଦି care ନ ନବା, ଯତ୍ନ ନ ନବା, so secondary infection ହେଇଯିବ, which can result in the formation of abscess. Then abscesses can also occur when the worm migrate to other tissue, lungs ରେ ହେଇପାରିବ, heart ରେ, pericardium ହବ, spinal cord ରେ ହବ, and it may lead to a bacterial infection. Also causes redness and swelling of the skin, sepsis, septicemia, joint infection, paralysis. Worm is often removed by by pulling, which is extremely painful to the person. बहुत कष्ट हुए, and in case if it breaks, जदि pulling बेले भांगी गला, छिंडी गला during the removal, the degradation of the remaining part can cause intense inflammation. से तो मरी जाइतिबो, किंतु तार भितरे रहि के degradation हबो, सेति बेले inflammation हबो. Inflammation means enlargement हबो, पोडिबो, pain हबो, swelling हबो, cellulitis. The worm calcified and encapsulated, which causes chronic recurrent pain and swelling. Then pathogenesis, three major disease, uh, emergent adult worm allergic reaction, allergic reaction of adult worm in the form of blister formation of burning pain of secondary bacterial infection jogu. Secondary bacterial means a blister जोटी कणा हे जाइतिबो अन्य bacteria प्रवेश करिवो. So secondary bacterial infection, bacteria drawn under the skin by retreating worms, lack of proper care, and third most common mode of entry for tetanus spores. So this opening will also may invite the tetanus causing spores to enter. Non-emergent worms माने if the worm will not emerge out, जदि इमर्ज ହେଇଗଲା ତାକୁ ଛୋଟ କାଠିରେ ରାପିଂ କରିକି ତାକୁ ଗୁଡେଇ ଗୁଡେଇ ଗୁଡେଇକି ସो ମାନେ ଭେରି ଭେରି ଟିକେ ଲୁଜ ହବ ଟିକେ ଗୁଡେଇ ଦବ ତାପରେ ସେମିତି ଛାଡିଦବ ତାପରେ ଆଉ ଟିକେ ଲୁଜ ହବ ଟିକେ ଗୁଡେଇ ଦବ at a time single attempt ରେ ସବୁ worm total worm ଟି ବାହାରି ପାରିବ ନାହିଁ. It takes hours together or days together. So non-emergent worms fail to reach skin, causing complication in deep tissue. ଯଦି ସେମାନେ emergent subcutaneous କୁ ନ ଆସିବେ ତାହେଲେ deep tissue ରେ ରହିକି ଆହୁରି complication କରିବେ. Absorbed and calcified ହେଇଗଲା ପରେ ସେ region ରେ ବହୁତ pain ହୁଏ. It can cause arthritis also, pain of the joint, paraplegia of the if worm in or paralytic type of, if the worm is present in the CNS, can be also found in the heart. Here you can see, yes, as this is the blister. गोटे छोट से जो ड्राकोनकुलस गोटे काठी रे मैस्टिक रे ताको टाई अप करा जाइछि एंड स्लोली एंड स्टेडीली ताको छोट 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 करी गुडे करी ताको कढा जिवो. This is the blister on the foot caused by dracon. So it is the removal of the guinea worm using a matchstick. Then complications, swelling, redness of a general is abscess of a lockjaw, the tetanus ହେଇଗଲା, spores ଚାଲିଗଲା, lockjaw ହେଇଯିବ, joint infection ହେଲେ arthritis of a joint to deform. If worm breaks during removal, inflammation ହବ, calcification ହେଇକିରି ସେଠି ରହିଗଲା, and this calcification may lead to disability in the movement. So diagnosis, there is no dependable method of diagnosis other than visibility of adult worm from the site of the blister. Blister जोठी ହେଲା adult worm देखा ଯିବ ଆଉ देखा ଯଦି ପାଖକୁ ଚାଲି ଆସିଲା immediately ତାକୁ ଧରିକିରି ତାକୁ ଗୁଡେଇକି ତାକୁ ବାହାର କରିବା କଥା. Appearance of an itchy red papullae that rapidly transforms into a blister. Blister formation ପୂର୍ବରୁ ଟିକେ କୁଣ୍ଡେଇ ହବ, redness ଆସିବ. It is the first strong indicator of infection. Then patients that had previous infection are often more aware of presence of the parasite. Kichi treatment by vaccine nahi. Simply removal of worm and care is the only treatment. Care mane joti blister hela, just you bandage it, you cover it, not to allow the for secondary infection by bacteria and other parasites. Wound area is to be cleaned gently. Worm is gently pulled out. Okay, worm is, if it is seen near the hole opening of the blister, it is simply pulled, gently pulled farther out until reach a resistance. So jete loose ହେଇଯିବ ତାକୁ pulling କରିବ, ତାକୁ matchstick ରେ ଗୁଡେଇ 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 ଆଣିବ, ଯେତେବେଳେ ଟିକେ resist ହବ tight ଲାଗିବ ଛାଡିଦବ. After resistance is made, pulling is stopped, so worm does not break. So don't allow the breaking of the worm. କାରଣ ବ୍ରେକିଂଟା ଯଦି ଭିତରେ ରହିଗଲା ତାହେଲେ ସରିଲା. And if it is possible ତାକୁ ପୁଣି surgically remove କରିବାକୁ ହବ. Portion of the worm that is emerged is wrapped around a stick or piece of gauze to maintain some tension, so worm cannot retract back into the body. ତାକୁ ଗୁଡେଇକି ରଖିବ, ନହେଲେ ସେ retract ଭିତରକୁ ଟାଣି ହେଇକି ପଳେଇବ. Topical antibiotics applied to prevent secondary infection. Now, dracunculosis medicine, all medicines are given for the secondary infection. Affected area wrapped in sterile gauze to protect site, and ibuprofen or aspirin are given to reduce pain. So painkiller खाइबो, inflammation टाको reduce करिबा पई ibuprofen, aspirin. Paracetamol may also be given. Steps are repeated until the entire worm is removed. So it may take several hours or days together to complete removal of the worm. So it can take several days to weeks depending upon the length of the work. Main control is you cannot control the copy pod, just you control. It is only through education. Safe drinking water, okay, safe drinking water, underground wells free of contaminants. So say it may deep जो चापाकल underground wells which is free of contamination. That means the tube well जो पानी है that is free of contamination. किंतु open well रे, so contamination, there is a chance of contamination. Then filter the drinking water to remove copypods. So copypods can be filtered. Okay, usually copypods do not pass through the filter. Uh, Avoid entering water used for drinking if have a blister or ulcer. So avoid entering water used for drinking. So if you have a blister, it should be of common sense that one should not move into the water to collect into the water which others take for drinking, which is a source for drinking water. So vector control, the vector is copypod. So if you kill the copypods by larvicides, then so if copypods are killed, then this disease can easily be controlled. Then it is dracunculosis. And complications, swelling of skin, redness, generally. um, uh, we have completed this, I think. So this is um, the control is through education. So when you are aware that ସମସ୍ତେ ବୁଝିପାରିବେ the copy boards are the responsible for the transfer of this parasite, then there is no need for the to uh, now will. So the slides for these two have been prepared, and I didn't get any time for the preparation. But I assure you that within a couple of days, I'll prepare the slide for the next three units, and I will share it with you if I get a chance. If I get have an access to your group. Certainly, if you have any doubt, you can always post it in the group. If I'm included, I will definitely serve for the for to clear your doubts. Now we'll move on to the. We have a very short time, so ectoparasites of animals. Okay, ectoparasites. So ectoparasites are those animals which don't enter into the human body. Rather, they not only human body but other animals. They remain outside the body, and their presence outside the body is intolerable. It causes some sort of disturbances or some sort of distress to the animal. So it includes flies. Okay, it includes flies. It includes ticks, uh, flies, ticks, mites, midges. These are the ectoparasites. They remain attached to the outer section of the domestic animals as well as the human body. So there are several flies, bot flies. As the name implies, it is a it resembles like that of the maggot, the larval stage of the other flies. So they are large sized flies whose body is covered with fine setae. Setae means hair like structure. They look like bees, and they have reduced mouth parts due to which they cannot feed. They are infested by in their larval stage. They are infested by the larva of these flies. So different animals, they have different form of the infection. There are animals like the dorsalo flies, which is the larval stage of dermatobia. It infects the cattle skin, causes meiosis. Meiosis is common in cats and dogs, especially in animals that are weak, that have weakened um, immune system. Then larval hypoderma, warble flies are there, sheep bot flies are there, um, the horse bot flies, they infect the horse. They are present on the skin of the horse. Sheep bot flies, they cause, they are present in the nasal cavities of the sheep and goats, and they cause a nervous condition called blind stagger, where the vision impairment is seen. Then you have the biting midges. Biting midges, that means they have uh, non-piercing mouth parts. Non-piercing means piercing mouth part roiche amaro yaro mosquito ro piercing mouth parts. So they have non-piercing mouth parts. The housefly have a sucking adhesive mouth parts. So these biting midges, they bite. So the most common biting midges uh, are the they have the mottled wings. They are the malicious biters, and they cause irritation to and annoyance to the animals where they bite. So the irritating bites cause scratching. ତ ସେମାନେ ସ୍କିନ୍ ଉପରେ ରହିଲେ ସେ କୁଣ୍ଡେଇ ହବ, କୋଉଠି ରବିଂ ହବ, କାନ୍ଥରେ ଇଏ ହବ, and rubbing of the scratching at these areas leading to the alopecia. Alopecia ଅର୍ଥ ହଉଛି ସେଠି ରୋମ ଗୁଡିକ
I am
ଝଡି
from Chhatrapur.
the hairs,
Hello.
the hairs fall. That is called the alopecia. It causes sweat itch. Then black flies are in the buffalo. Then sand flies. The sand flies. It looks like a moth, but their wings are present in an V-shaped structure, and they are the sandfly. As we have yesterday studied, they are the intermediate host for the leishmania. Um, so these sandfly also belong to the flies. They bite and carry the disease. Then houseflies and deer flies, horseflies and deer flies. The adult females, they have scissor-like mouth parts, conche body, scissor-like mouth parts. So all these flies, they tear the tissue and consume the oozing blood. Se kona kar debe. And they inflict highly painful and irritating bites on the legs, neck, and underside of the abdomen around the navel. Nahi pakha region re abdomen. Seti skin ta tike soft thai. Se region re semane जो हॉर्स फ्लाई एंड डियर फ्लाई ସେମାନେ କାମୁଡ଼ି ଦିଅନ୍ତି, ସ୍କିନ୍ କଟ୍ କରନ୍ତି, ସେଠୁ ବ୍ଲଡ୍ ବାହାରିବ. ଦି ବ୍ଲଡ୍ କଣ୍ଟିନ୍ୟୁସ୍ ଟୁ ୟୁଜ୍ ଫ୍ରମ୍ ଦି ଓପେନ୍ ଉଣ୍ଡ ଇଭେନ୍ ଆଫ୍ଟର ଦେ ଲିଭ୍ ଦି ହୋଷ୍ଟ. ସେମାନେ ପଳେଇଗଲା ପରେ ମଧ୍ୟ ସେ କଣ୍ଟିନ୍ୟୁ କରିବ ଫର୍ several hours, and depends upon the continuity, depends upon the size of it. So these flies may also act as the transmitter, mechanical carrier of certain diseases like anthraxella, equine infectious anemia, and so on. So flies, you have stable flies which infect the horses. Okay, stable flies. So these flies is a biting housefly. Generally, housefly does not bite. It is a biting housefly because it belongs to family Mucidae, musca musca, the housefly common name. So they belong to family Mucidae, and these flies, both male and female, they feed on the warm blooded animal, and horses are the preferred host. That is why it is called stable flies. Stable माने जो ग्वाला जोटी horse को बंधा जाए ताको stable कहा जाए. So stable flies infect the horses in their stable. So these in जो कामुड़ी पे when they bite, they inflict painful bites, usually on the legs and ventral abdomen and ears. Irritating bite leads to the blood loss and decreased efficiency in converting feed to uh, meat or milk. Blood ଅଭାବ ରହିବ ଇକୋନୋମିକାଲି ସେଟା କମିଯିବ କ'ଣ ଯୋଉ ଫିଡିଂ ଆମେ ଦଉଛେ ଫିଡ୍ ରୁ ଯୋଉ ମିଟ୍ ଫର୍ମେସନ ହବ ବା ମିଲ୍କ ଫର୍ମେସନ ସେଟା କମିଯାଏ ସୋ ଦି ଏଫିସିଏନ୍ସି କମିଯାଏ so economically distress hobo economical loss hobo so these flies can also transmit various bacteria also and viruses buffalo flies tsetse fly janicho they are responsible the glossina palpalis are responsible for the passing or the transmission of the trypanosoma brucei and spider flies roichi these they parasitize the horses and sometimes other cattle पेरियानल रीजन माने anal region चारिपटे से माने आक्रांत करंती से माने बाइट करंती and between the hind legs पछ गोड़ मझिरे causing nuisance and immense disturbance to the large domestic animals in the region where they cannot get rid of uh, these flies. Next is the mosquito. Mosquitoes, you know, um, they are responsible for major global diseases. Now, next we have the roundworm. Roundworms, Tyrophilaria immitis, and spread by mosquitoes. So, mosquito are also responsible for the spread of the certain helminthic parasite like I mean, filarial worm padle. So, one such roundworm that is Tyrophilaria immitis, it is spread by mosquito responsible for dog heartworm disease. Dog heartworm disease. It is simply filarial worm, it is microfilaria. They circulate in the bloodstream. Kukurara. ତାପରେ କ'ଣ ହବ they develop in the say larval stage ଗୁଡ଼ିକ develop କରିବ and the infective larvae are deposited on the surface of the host skin which enter the worms they grow and multiply and inhabit the blood vessels supplying blood to heart and lungs. যদি অত্যধিক ইনফেকশন ହେଇଯିବ heartworms can enter the heart and cause heart stress and inflammation of the blood vessels, heart chambers and lungs. So basically ସେମାନେ heart କୁ ଆକ୍ରାନ୍ତ କରନ୍ତି directly by indirectly ସେଇଥିପାଇଁ ତା ନାଁ ହେଲା dog heartworm disease because they infect the dog. Common symptoms ହଉଛି ଛିଙ୍କିବେ growth ହବ ନାହିଁ bluish purple discoloration of the gums of the dog and the skin spitting blood ତାଙ୍କର ଯୋଉ ଇଏରେ ସାଲିଭାରେ blood ରହିଥିବ spitting blood then nausea fainting nasal bleeding ହବ abdominal edema means যেটা ফুলি ଯିବ bodyটা next is the eastern equine encephalitis. Equine means horse. Encephalitis means it is जो पढ़िथिबा निश्चित भाବରେ it is caused by a virus. Eastern equine encephalitis is caused by a virus. And this virus it spreads through the mosquito. I mean mosquito fly ବିଷୟରେ ପଢୁଛେ. So it is transmitted by Culex species a rogoti Eastern equine encephalitis. And it has the affects the central nervous system. So encephalon mane nishchito bhabare nervous system or brain. It affects the central nervous system and cause severe complication leading to ultimate death of the animal. Death of the animal. That is equine. That is a horse. So this this virus has a complex life cycle. Virus life cycle they complicated. Kaiki? Now it is present in the birds. The birds देहरु mosquito आनिबो and तापर mosquito जेतेबेले कामुडिबो horse को horse रे सेटा रही but transmission to mammals such as horses requires another mosquito species to create a bridge. The bird होची reservoir चढ़ई माने होचंते reservoir चढ़ई देहरु horse देह को जीवा ପାଇଁ to cause eastern equine encephalitis. It is mediated by a mosquito. So mosquito acts as a bridge for transmission of these virus from the birds to the କିନ୍ତୁ ହର୍ସ ରିଜର୍ଭର ନୁହଁ, ବର୍ଡ ହଉଛି ରିଜର୍ଭର, ହର୍ସ ହଉଛି ଏଣ୍ଡ, ଡେଡ୍ ଏଣ୍ଡ। ତେଣୁ ହର୍ସ ରୁ ମସ୍କିଟୋ ଆଣିପାରିବନି। Horse hochi dead end. Only it will release in the body of the horse so that the horse will suffer. କିନ୍ତୁ ତାଙ୍କ ଦେହରୁ mosquito ଆଣିକିରି ଆଉ ଗୋଟେ horse କୁ ସେଟା infection ହେଇପାରିବନି. That is why it is called the dead end host. Dead end host. So it is most common disease in the western region. So symptoms hochi mild flu-like illness. It's ରହିଥିବ accompanied by fever, headache, and sore throat. Uh, then we come to the out a viral disease, West Nile fever, you must have heard, and it is also transmitted by the mosquito. Bises bhavare Culex mosquito and Culex pipiens mosquito, Restvans mosquito, Culex restvans, Culex modestus. They carry this virus. So this is a flavivirus, West Nile virus, and it causes fever known as the West Nile fever. Aedes mosquito and ticks have also been reported to carry this virus. The virus it will circulate in their lymph, in the lymph of the insect, that is the mosquito, for a few days, and they will reach the salivary glands, and these are again transmitted to the horses while taking a blood meal. ତେଣୁ mosquito body ରେ କିଛି develop କରିକିରି ତାପରେ ସେଟା transmit ହେଇଯିବ horse body କୁ. West Nile virus. Mosquitoes that feed on birds as well as mammals are referred to as the bridge for the West Nile fever. West Nile fever hochi the disease name, and West Nile virus hochi say parasite rona. It is a virus. It is transmitted by means of the mosquito from the birds. Symptoms of this West Nile virus is the same thing. It causes splenomegaly, then the myocardial they become paler, then hepatomegaly, brain shows lymphatic perivascular infiltration, neuronal degeneration, that means degeneration of the nervous tissue, which results show signs of incoordination, non-coordination. Infected horses show neurological signs. Neurological signs mane symptoms mane hochi sensitivity, abnormal sensitivity to sights, sound. They will not respond to sound. They will not respond to your command. Horses mane horse ro jo maliko se command ko ye karibani chini paribo nahi, or they will not respond to touch. Then head pressing, te munda taku gote ye solid object ସହିତ ପ୍ରେସ୍ କରିବେ, ତାମାନେ ସେଟା ବିନ୍ଧୁଥିବ ତାଙ୍କୁ। ଦେନ୍ ମଜଲ ଟ୍ୱିଚିଂ, ମଜଲ ମାନେ ତାଙ୍କର ଯୋଉ ଆଣ୍ଟିରିୟର ପାର୍ଟ ଅଫ ଦି ନୋଜ ଟ୍ୱିଚ୍ କରୁଥିବ, impaired vision ଦେଖାଯାଉନଥିବ, and swallowing difficulty due to which they don't feed, swallow difficulties ଗିଳି ପାରୁନଥିବେ, lack of coordination, and ultimately it leads to seizure ମାନେ total ମାନେ ଯୋଉ କୋମା କଥା କହିବା, paralysis, convulsion, and ultimately death. Then next disease which is carried by mosquito, Japanese encephalitis. ଏଠି ବି ସେ brain କୁ affect କରୁଛି, and this is caused by Japanese encephalitis virus. Carrier ହଉଛି Culex born, Culex species of mosquito. It is ତାର susceptible animal, ଏଠି ବି ସେ horses ରହୁଛି. Okay, horses ରହୁଛି. So susceptible animals mainly horses ରହୁଛି. They also infect pigs and birds and can have large amount of virus in their blood. But mosquito obtain the virus while feeding on infected animals, and infection does not spread directly from animal to animal. Animal to animal, and thus the infected animal is called a dead end of the host. So dead end hochi, horse hochi dead end, human being hochi dead end. ସେଥିରୁ ଅନ୍ୟ ଇଏକୁ ଯାଇପାରିବ, only it is transmitted from the natural reservoir ହଉଛି birds. ସେଥିରୁ ଅନ୍ୟ ଆନିମାଲକୁ ସେମାନେ ଇନଫେକ୍ଟ କରିପାରିବେ। ହର୍ସକୁ ଯଦି ଆସିଲା ସେଟା ଡେଡ୍ ଏଣ୍ଡ ହେଇଯିବ। ଆଉ ହର୍ସକୁ ଇନଫେକ୍ସନ ହେଇଥିଲେ ଯୋଉ ଜାପାନିଜ ଏନସେଫାଲାଇଟିସ୍, they are usually asymptomatic, କୌଣସି ପ୍ରକାର symptoms ଦେଖାଯାଏ, but severe cases may result in brain infection, that means encephalitis, inflammation of the brain, Fever hobo, inability to walk, they cannot run. Jaundice hobo, that means release of destruction of more number of RBC. जो bilirubin बाहरिब, they impart the yellow coloration. So it means jaundice. They are lethargy. Lethargy means they are unable to walk. They don't like to walk. They don't like to run. Um, then the anorexia and teeth grinding, जो दांत चोबेबे. Okay, anorexia. Neurological signs, incoordination, non-coordination, ଗିଳି ପାରିବେନି ଖାଦ୍ୟ, impaired vision, ଚିହ୍ନି ପାରିବେନି, sound detect କରିପାରିବେନି. All sense organs which are controlled by the brain, ସେଗୁଡ଼ିକ impaired ହେଇଯାଏ by this virus. Then newly born जो pigs रे newly born piglets have piglets माने जो घुसुरी छुआ, they have tremors, convulsions and seizures. And infected pig also show abortions, okay, before the terminal uh, uh, term end ରେ ପୂର୍ବରୁ ଛୁଆ ଗୁଡ଼ିକ birth ନେଇଯିବେ. Next ହଉଛି Venezuelan equine encephalitis, ଏଇଟା ହଉଛି ମଧ୍ୟ it is caused by a virus. ସେ virus ନା ହବ VEE, Venezuelan equine encephalitis virus. And this virus, it is also infective agent, infects horses, donkeys and mules. Okay, horses, donkeys and mules. It also affects other animals like swine, the pigs, the dogs, cattle, but they are asymptomatic. Here also it is transmitted by the mosquito vector. ଯେତେବେଳେ ସିଏ ଆଉ symptoms ହଉଛି କ'ଣ, fever, weight loss, weakness, anorexia, dehydration, depression, paralysis, difficulty in swallowing, seizure, ଏଗୁଡ଼ିକ ସବୁ common ଯୋଉଠି ଭାଇରସ ଦେଖିବ, suffering ଯୋଉ horse କୁ infect କରୁଛନ୍ତି, all these are common symptoms, ସେଟା ଆରାମସେ ଲେଖିପାରିବ. Next is the ticks, ଯୋଉ ଟିଙ୍କ, ଯୋଉ ଦେଖିଥିବ cattle ରେ, dogs ରେ, ଯୋଉ pet ରେ. So these are the ticks. Our ticks can be, they are 6 leg larval stage. ଆଉ nymph stage ରେ ତାଙ୍କର 8ଟି ଗୋଡ଼ nymphal stage ରେ ରହିଛି. So life cycle of ticks ରେ larval stage ରେ 6 leg larval stage. So ticks ଟିଙ୍କ ଯୋଉଟା ରହିଛି, they are also um, get attached to the skin of the carriers and cause many deleterious effect on the host. Main ହେଲା skin ଉପରେ ଆରିବ, dermatitis ତାକୁ କୁହାଯାଏ, hair fall ହବ, inflammation ହବ skin ର, blood loss ହବ ଅତ୍ୟଧିକ ସେମାନେ ଯଦି bind ହେଇକି ରହିବେ. Then pruritus, pruritus means କୁଣ୍ଡେଇ ହବ ସେ ଜାଗାରେ, ବହୁତ କୁଣ୍ଡେଇ ହବ, pruritus. Edema, enlargement ହବ, erythema, the skin redness ହେଇଯିବ, ନାଲି ହେଇଯିବ. Then papules, ଛୋଟ ଛୋଟ ଘେମିରି ଭଳି ବା ଯୋଉ ଇଏ papules develop କରିଯିବ, blister like papules. Scaling and ulceration, scaling means dryness ଭଳି ଦେଖାଯିବ, ଆଉ ତାପରେ କୁଣ୍ଡେଇ ହେଇକିରି କ'ଣ ହବ, ulcer formation ହେଇଯିବ. So along with this, ticks can transmit many pathogenic fungi, virus, protozoa and bacteria. So କିଛି ticks ର ନାଁ ରହିଛି, tick suppose looping ill. Okay, looping ill. So it is a viral disease of the CNS, central nervous system, caused by Ixodes ricinus. Okay, Ixodes ricinus. So এই जो Ixodes ricinus, ये होची गोटे tick, गोटे tinker, and it carries this virus that causes disease affecting the central nervous system, and this disease is called looping ill. Looping ill. Infection होची goats ର, sheep, cattle, horses, pigs. କ'ଣ ହବ ଏଥିରେ? So it leads to initially it replicates in lymphatic, leading to viremia for 1 to 5 days. That means increasing load of the virus, ତାକୁ viremia କୁହାଯାଏ. Symptoms होची muscular tremors, nervous gnawing, ataxia, balance ରହିବନି. Ataxia होची impaired balance, they cannot balance. ଏପଟ ସେପଟ ଢଳୁଥିବେ। ୱିକନେସ୍ ରହିବ, ଲେଥାର୍ଜି ରହିବ। ୱିକନେସ୍ ରହିଲା ମାନେ ଲେଥାର୍ଜି ରହିବ, ଦେ ଡୋଣ୍ଟ ଫିଲ୍ ଲାଇକ୍ ମୁଭମେଣ୍ଟ and ultimately death. So all these viruses ଯୋଉଗୁଡିକ they are also all ଯୋଉ ତାର ଇଏ ହବ କନଫର୍ମେସନ ଡାୟଗ୍ନୋସିସ୍ ହବ only through RT-PCR. Okay, RT-PCR ଯେମିତି ଆମର କୋଭିଡ ଭାଇରସ RT-PCR. Then there are other forms of ticks that causes different diseases. Tularemia is caused by a bacterium, infectious bacterium, and it affects the sheep, cats, dogs, and it is transmitted by the wood tick, Derma center andersoni. It is transmitted by Derma center andersoni, which is commonly called as the wood tick. So tularemia is the disease, and here and they it infects the canines. Okay, canines, that means dogs, cats, and other carnivores. Symptoms hochi fever hobo, headache hobo, chills মানে ঠান্ডা কম্পন হবো, respiratory infection, coughing, diarrhea, and swelling of the lymph nodes. Then we come to the mites. Okay, ticks or mites, এটা টিকে অলগা. Both are belong to phylum Arthropoda. ଅଧିକାଂଶ ସବୁ arthropoda, mosquito ସବୁ arthropoda. So mites like ticks are eight-legged arthropods with unsegmented body, is not segmented, and they are tiny, less than 1 millimeter. You might length ରହିଛି, very small. They also cause certain disease. One such mite disease is scabies mangae. It is a contagious ମାନେ ଛୁଇଁକିରି ମାନେ ବ୍ୟାପି ଯିବ through touch. It is a contagious disease caused by the Sarcoptes scabi. ତାକୁ scabies କୁହାଯାଏ, ଯୋଉ କୁଣ୍ଡିଆ ତାକୁ, okay, କାଛୁ କୁଣ୍ଡିଆ ଯୋଉଟା, which penetrate the stratum corneum of the skin epidermis and burrows tunnel. A few mites species affecting mammals are in dogs. So it is caused by this this bacterial disease. It is caused by female Sarcoptes scabi, which penetrates the, and this penetration it is carried by the mite. Then you have the symptoms is pruritus, that means itchy skin, both kunde of severe itching in the affected area due to allergic reaction to the parasite proteins and feces. Primary lesions consist of tiny छोट छोट blister formation ହେଇଯିବ, papular scabies ମାନେ eruption ହେଇଯିବ, nodular look ରହିବ, yellow crust. Then erythema and alopecia, that means alopecia जो ରୋମ ଗୁଡ଼ିକ ଝଡ଼ିଯିବ, hair fall ହେଇଯିବ, irritation and scratch cause bleeding. ଏତେ କୁଣ୍ଡେଇ ହବ ଯେ it may lead to bleeding also. So irritation and scratching cause bleeding and wound formation. Then you have Soroptic mangae. It is species also affect different mammals, causing intense pruritus, itching. So all these जोटा skin सहित ସବୁବେଳେ ଦେଖିବ hair fall ହବ, skin eruptions ହବ, itching ହବ, unless and until it travels, if it moves into the CNS, ସେଠି ଦେଖିବ seizure ହବ, ସେଠି vomiting ହବ, ସେଠି in-code non-coordination, ଏ ପ୍ରକାର ସବୁ you can write it down. Then walking dandruff, that is chilitellosis. It is a highly contagious disease. It is caused by Chilitella blacki in cats. So it is a mite. The disease is characterized by scaling. ମାନେ ଆମର winter season ରେ ଯେମିତି skin scales ଗୁଡ଼ିକ scaling ହେଇଯାଏ ନା, dry scales ଗୁଡ଼ିକ ପଡ଼ିଯାଏ, ତ ସେଟା ହବ, pruritus ହବ, ଯୋଉ hair fall ହବ, which may be absent or severe. Cats can also develop dorsal crusting. Mites and eggs are not easy to find. So এটা mites কলা. Then we have the lice. You know lice, unkuni. Okay, So there are the skin louse, the head louse, the biting louse. So biting louse, these lice are generally host specific. Host specific. When they prefer a certain host. The Monisera, they cannot, you will not find them in any other animal. So they are host specific ectoparasites and completely depend upon the host to complete their life cycle. ତ କେତେବେଳେ ଡୋମେଷ୍ଟିକ ଆନିମାଲ୍ସ ରେ ମଧ୍ୟ ସେମାନେ ଦେଖାଯାନ୍ତି by biting or chewing. They are parasites by chewing lice, biting lice, and sucking lice. ଏଇ ଯୋଉ ତିନି ପ୍ରକାର ଲାଇସ୍ କିଛି ଡୋମେଷ୍ଟିକ ଆନିମାଲ୍ସ ରେ ଦେଖାଯାଏ, ହ୍ୟୁମାନ ବିଙ୍ଗ ରେ ବି ଦେଖାଯାଏ। ବିଶେଷ ଭାବରେ they inhabit the hair or feathers. Okay, hair or feathers, hair follicle, ତ ମାନେ ଯୋଉଟା ମୁଣ୍ଡରେ ଯୋଉ ଉଙ୍କୁଣି ଥାଏ ସେ ହେୟାର ଫଲିକଲ୍ସ, ତ ପାର୍ଟିଂ, ଯୋଉମାନେ ଉଙ୍କୁଣି ବାଛନ୍ତି ପାର୍ଟିଂ କରିକିରି ତାକୁ ଦେଖନ୍ତି ଟୁ ଫାଇଣ୍ଡ ଦି ପ୍ରେଜେନ୍ସ ଅଫ ଦିସ୍ ଲାଇସ୍ at the base of the root hair. So they have a very, in order to cling ମାନେ ତାଙ୍କର ବହୁତ ବଡ ମାନେ ଷ୍ଟ୍ରଙ୍ଗ କ୍ଲଜ ରହିଛି, ସେ କ୍ଲଜ ସାହାଯ୍ୟରେ ସେ ଲାଖିକି ରହିଥିବେ ସେ ରୁଟ୍ ଯୋଉ ହେୟାର୍ସ ରେ। ଚୁଇଂ ଲାଇସ୍ attack many, mainly birds and some mammals. ତାପରେ ବାଇଟିଂ ଲାଉଜ ବର୍ଡସ ରେ ରହିଛି, ଡଗ୍ସ ରେ ରହିଛି, କ୍ୟାଟ୍ସ ରେ ରହିଛି। So they are also called chewing louse. Dog chewing louse, it is found in dogs like Trichodectes canis, ତା ନାଁ ହେଲା। Cats ରେ ମଧ୍ୟ ରହିଛି, cattle and sheep ରେ ରହିଛି। Damalinia bovis, they are the red louse found in the cattle, horse or donkey ରେ ମଧ୍ୟ। ତ ସବୁ animal including human being ରେ you find these lice. Okay, they cling to their body. So sucking louse are they suck the blood. Sucking louse, they are found in all mammals, domestic mammal, dogs, cattle, sheep, goats, pigs. Now, this pathogenicity and symptoms, these lice there. So usually they feed on skin secretion. ସେମାନେ ଯୋଉ ସ୍କିନ୍ ରହନ୍ତି, ସ୍କିନ୍ ରୁ ଯୋଉ secretion ହୁଏ or ଯୋଉ ତାଙ୍କର କ୍ଲିଙ୍ଗିଂ ଯୋଗୁ ଯୋଉ ଟିକେ ବ୍ଲଡ୍ ବାହାରିଥିବ ସେଟା ଡ୍ରାଏ ହେଇଯାଇଥିବ, so dry blood ମଧ୍ୟ ସେମାନେ feed କରନ୍ତି। they feed on the fur and the skin debris, ତାମାନେ worn out ଯୋଉ dead cells ଗୁଡିକ ସ୍କିନ୍ ରୁ ବାହାରେ, skin debris ତାକୁ feed କରନ୍ତି। The infestation of animals with lice is called pediculosis. Okay, pediculosis. So pediculosis can result in ବିଶେଷ ଭାବରେ dermatologic disease of skin disease of production loss of and occasionally anemia of anemia is related to the amount of blood present in symptoms scratching, ସବୁବେଳେ କୁଣ୍ଡେଇ ହବ, pruritus, that means redness with scratching, dermal irritation, rubbing and scratching often resulting in broken fibers in sheep and goats. ତ ସେମାନେ କୁଣ୍ଡେଇ ହେବେ, ଗୋଟେ କାନ୍ଥରେ ବା ଏଠି ହାର୍ଡ ଅବଜେକ୍ଟରେ ସେ କୁଣ୍ଡେଇ ହେବେ, rubbing and scratching. Then restlessness behavior, ତ ରେଷ୍ଟଲେସ୍ ତାଙ୍କୁ ଅସ୍ଥିର ଲାଗିବ ଏଇ ଯୋଉ ଶିପ୍ ମାନଙ୍କୁ, ବିକଜ ଅଫ ଦି କ୍ରଲିଂ ଆଣ୍ଡ ପିୟର୍ସିଂ ଅର ବାଇଟିଂ ଅଫ ଦି ସ୍କିନ୍। ସେମାନେ କ୍ରଲ କରିଥିବେ, ତାପରେ କୋଉଠି ପୁଣି ପିୟର୍ସ କରିବେ, କୋଉଠି କାମୁଡି ଦେବେ, ଏ ପ୍ରକାର ରେଷ୍ଟଲେସନେସ୍ ବିହେଭିୟର ଦେଖାଯାଏ ଆନିମଲ୍ସ ମାନଙ୍କରେ। lack of thrift in young birds, loss of vent feathers and scabs around it. तो bird ମାନଙ୍କ କ୍ଷେତ୍ରରେ ଲାଇସ୍ ରେ ହେଲେ lack of thrift. Lack of thrift means they are unable to take off from the branch. Okay, so loss of vent feathers, तो anal feathers ରେ जो anal region ରେ जो feathers ରହିଛି ସେଟା lost ହେଇଯାଏ। ତାପରେ କଣ ହବ, they cannot use at a rudder. So ସେଇଥିପାଇଁ କୁହାଯାଉଛି loss of lack of thrift in young birds. Then loss of hair and rough dry skin of the uh, skin coat of the dogs, and then pruritus, small wounds ଦେଖାଯିବ। ତାପରେ ନେକ୍ସଟ ଆନିମାଲ ହଉଛି ଏମାନଙ୍କର ଇନଫେକ୍ସ ଯୋଉ ଡାୟଗ୍ନୋସିସ୍ ହଉଛି, it is made by manual observation. Okay, manual observation. Either you find the adult animal or their eggs. तो eggs ମଧ୍ୟ ସେମାନେ release କରନ୍ତି which cling to the hair or cling to the fur of the animal. So say egg ଆଉ ତାର different larval stages ଗୁଡିକ manually jodi ame dekhiba the yes, this animal has been, or this human being is suffering from lice. So biting lice being active can be seen moving through the hair, while sucking lice usually move more slowly and are found with mouth parts embedded in the skin. So generally, ebe jo ye roichi, if the head is, in case of human being, if the head is fully loaded or infested with this head louse, so similar, if you rub with a towel, so some of these parasites you can find them. So generally they get rid of it through using specific combs, and certain chemicals are also. Now you have the fleas, water fleas. The fleas, they are small apterous. Apterous means they don't have any wings to fly. They are arthropods, more or less oval in shape. Uh, their compressed body is compressed laterally. Laterally means side ru chepai ki roichi body, and their color varies from light to dark brown. And the adults are tolerant to arid climate, and there are different types of fleas present. They are responsible for the deadly disease that is caused by plague. So it is a vector of plague. Um, then murine typhus fever also, it is uh, transmitted by flea. So flea, they have jointed appendages in the form of legs, and they transmit other parasites too. One such disease is plague. Plague is a bacterial disease. It is transmitted by flea of rats and other rodents. It is called Black Death due to severe cyanosis. Cyanosis means the color of the due to lack of oxygen, the color of the skin becomes bluish. Okay, bluish purple colored. So it is called Black Death. In addition to rodents, this plague, uh, this bacteria that causes plague disease infects also other mammalian species, rabbits, then felids. Okay, felids, cats, felids, canids, and some ungulates. Okay, जो खुरा रही गोड़े ungulates तक कुहाଯାଉଛି. So different types of plagues are there. Bubonic plague रही, and bubonic plague, septicemic plague. तो bubonic plague रे होଉଛି कौन? Inflammation of the lymph nodes. तो lymph node, a जो bacteria lymph node को infect करिवो, and these lymph nodes which are infected, they become swollen. The swollen condition of the lymph node को हमें कहूचे buboes. So this bubonic plague, and they show the symptom, uh, onset of fever, recurring chills, ଥଣ୍ଡା କମ୍ପ ଲାଗିବ, fatigue, malaise, um, ଖାଇବାକୁ ଇଚ୍ଛା ହବନି, loss of appetite, lethargy. When you lose the appetite, don't feel like eating, that means you know don't have energy. So obviously lethargy ame lekhi pariba. Muscle aches, and in advanced stages of infection, the inflamed lymph nodes can turn into open sores, କଣା ହେଇଯିବ, filled with pus. Mouth and skin abscesses, discharge from the eyes, diarrhea, vomiting, these are the symptoms. Then uh, another disease is murine typhus fever, transmitted by the fleas. It is caused by a bacteria. So bacteria, a flea mane a bacteria को transmit करती different animals को. And this bacteria being transmitted by these fleas causes different type of disease. One such disease होची typhus fever. Our typhus fever, uh, it is mainly found in case of the felis. Okay, felines. Uh, felis माने जो cat family रे maintain primarily in ତାର rodent ମାନେ ମୂଷା ମାନେ ହଉଛନ୍ତି reservoir. So here symptom ହଉଛି typhus fever ରେ rash ଦେଖାଯିବ, skin lesions, ଛୋଟ ଛୋଟ skin ରେ eruption ହବ, nervous syndrome ରହିବ, renal disorder ରହିବ. renal ମାନେ kidney will not function, urine formation ହବନି ଭଲ ଭାବରେ. common symptoms ହଉଛି fever ରହିବ, କ୍ଳାନ୍ତ ଲାଗିବ, tiredness, joint pain, muscle aches, vomiting habo, nausea rahibo, and the diagnosis, of course, RT-PCR, okay, PCR, or fluorescent antibody, where you uh, detect the level of antigen present in the animal body, the load of antigen present in the animal. So this is all about the ectoparasites of. Now, nematode parasites also are present. The parasitic nematodes which infect the plants also, and these parasites, after infecting, they reproduce. They have male and female, but they infect, instead of animals, they infect the plants, and they cause different types of disturbances in the plant. That means diseases in the plants are also exhibited, where mottling or discoloration of the leaf, patra jhora rahibo. So basically they infect the root nodules, okay, root region रे ସେମାନେ infect କରନ୍ତି ଏ जो plant nematodes, and they may move from one root to the next. During this process, they uh, multiply, and their larvae are released into the soil uh, surrounding the root. So definitely, most nematode parasite of plants, they are dioecious with separate male or female roichi, sexually dimorphic roichi, and they are identified by the presence of their hook-like spicules. Nematode parasite to hook roitiba, hook-like spicules at their cloacal end. Female gonads are in pair, didelphic, elongated thread-like. So some species contain pouch between the orbitals. These are the structures of uh, these nematode parasite. Now here they generalize the cycle pattern of nematode parasite of plants, depending depending on the environment and the species. Most nematode females, they produce huge number of eggs, while females of some species can produce even thousands of eggs. The eggs guriko koti, since they infect the roots, they are laid in the roots, and from where, or in the soil, or in a gelatinous envelope called the egg mass. Egg taro larva bari asiba, it is called the infective stage, and they develop further only if they find a, if they are in the soil, তাহলে ଗୋଟେ plant root କୁ ଯଦି ପାଇବେ ସେମାନେ ତା ଭିତରେ ପ୍ରବେଶ କରିକି they will develop. ଯଦି plant root ନ ପାଇବେ they will perish. So if the eggs are released near the roots, ତାହେଲେ କ'ଣ ଅଛି, ସେଇ root ପାଖରେ ସେ ଆହୁରି reinfection ହେଇଯିବ. So length of this life cycle of these plant nematodes, they vary considerably depending upon the species of the host plant, of course, and the temperature of the habitat. କୋଉ ପ୍ରକାର କୋଉ ପ୍ରଜାତିର plant ଆଉ କୋଉ type ର temperature ରହିଛି ସେଠି. Many species complete their life cycle in about 4 weeks. Summer months रे, କାରଣ summer months ରେ soil temperature ବହୁତ ଅଧିକ ରହିଥାଏ. So 4 weeks they complete their life cycle. So in their life cycle, they pass through different juvenile stages. Uh, so adult ରୁ egg ଆସିବ, ତାପରେ larval stages ଗୁଡ଼ିକ molting ହେଇକିରି then they will become the adult. So during this process, they enter into the plant tissue, and entry into the plant tissue, it results in the the appearance of different type of symptoms in the plants. So they plant nematodes, which are parasite to plant, they have feeding behavior. Uh, it is called stylet feeding. That means ଗୋଟେ stylet apparatus ଗୋଟେ ରହିଛି ଯାହା ଦ୍ୱାରା ସେମାନେ ତାର ସେଲ୍ ସାପ୍ କୁ ପହଞ୍ଚି ପାରିବେ, ତା ଦେହରୁ ଜୁସ୍ ସେଲ୍ ଯୋଉ ସେଲ୍ ସାପ୍ ଟାକୁ ଟାଣି ପାରିବେ. They puncture the host cell and inject enzymes into the host cell. The enzyme भी ଛାଡ଼ିଦେବେ ସେଲ୍ କଣ୍ଟେଣ୍ଟ କୁ, ସେମାନେ ସେଲ୍ ୱାଲ୍ କୁ ଡାଇଜେଷ୍ଟ କରିବ, ଡାଇଜେଷ୍ଟ କରିସାରିଲେ ସେଲ୍ ସାପ୍ କୁ ସେମାନେ ଫିଡ୍ କରନ୍ତି. They feed deep within the roots, and ସେଠି feeding ହେଇଗଲେ କ'ଣ ହବ, it will impair with the development of the plant. Okay, it will impair with the development. Sometimes a parasite ର ଉପସ୍ଥିତି ଯୋଗୁ large lesions that may kill the plant completely withdrawing their food, large lesions ମାନେ growth ହେଇଯିବ, so cell sap କୁ ଏମାନେ ଟାଣି ନିଅନ୍ତି, ତା ଦେହରେ କଣ ହବ, the plant will die. The example of such nematodes, lesion lands. Some nematodes do not kill the plant cell, କିନ୍ତୁ they stimulate them to enlarge and grow. So ସେଠି ହଉଛି କଣ, ସେଲ୍ କୁ ମଲ୍ଟିପ୍ଲାଏ କରିବା ପାଇଁ ସେମାନେ ବାଧ୍ୟ କରନ୍ତି, ଏନଲାର୍ଜ ହେଇଯିବ। In response, the plants produce one or more nutrient-rich feeding cells by repeated nuclear division, resulting in the formation of a syncytium. ତ ସେ ଇଏ କରନ୍ତି, they cause the plant to grow enormously. କିନ୍ତୁ କେତେ ଗୁଡେ ନେମାଟୋଡ୍ସ ଗୁଡିକ, like the root knot nematode and soybean cyst nematode, enter the roots and establish permanent feeding. ସେମାନେ ଆଉ detach ହେବେ ନାହିଁ, they complete their life cycle there without killing the cells around them, କାରଣ killing ହେଇଗଲେ ସେମାନେ ମରିଯିବେ, but extensively they go on damaging the root system. The injury caused by nematodes provide an opportunity to other plant pathogens. Same ମଣିଷ ଦେହରେ ଯାହା ରହୁଛି, whatever you see find in the human body, if a parasite have entered your body and it has it has developed a lesson, it will find, it will attract the entry of other pathogens responsible for other disease. Same thing in case of plant also. When the tissue are destroyed, it there is a open means by which it provides an opportunity for other plant pathogens to enter, and they will, in addition, they will affect the plant in different forms. So ectoparasitic nematodes of the plant, they feed on the plant tissue externally, generally root cell. The ectoparasite plant रे भी ectoparasite रही, they बाहर से मैंने attach ହେଇକିରି से root cells ରୁ juice टाକୁ से मैंने ये करिवे, हाँ, तो they help they insert their stylet, which are extremely long, जोड़ा ectoparasite रही, into the cell, deep into the cell, to reach the nutrient root rich root cells. Then endoparasite ସେମାନେ ପୁରା ଭିତରେ ରହିଥିବେ, in the plant tissue ଭିତରେ ରହିଥିବେ, where they gain protection, they protect ହେଇକି ରହିବେ, pesticide ଗୁଡିକ plant ଭିତରୁ ଯାଏନି, external, ତ ସେଇଥିପାଇଁ ଯୋଉ external parasite ଗୁଡିକ ରହିଛି plant ରେ, if you apply pesticides or any chemicals, they are killed, but not the endoparasite, because they are well protected by the within the plant tissue. Our semi-endoparasitic nematodes are partially penetrate the plant and feed on the plant tissue. पूरा संपूर्ण भाବରେ ଭିତରେ ଯିବେନି, partially penetrate करिवे, ताको कहे semi-endoparasitic nematodes. There are endoparasitic nematodes or migratory parasitic nematodes. Adult females, they migrate freely through the soil or plant tissue. They feed on the plant tissue and migrate into the soil in search of new roots to attack. So taku kahe migratory parasitic nematodes. Then common parasitic nematodes plants there are root knot nematodes roichi, reniform nematodes roichi. So these are the disease name, common name, but they have scientific name also. Species like Meloidogene incognita are the responsible for root knot disease. What is root knot? Knot K-N-O-T. ତା ମାନେ ଗୋଟେ knot like structure, ହେଲା, ଗୋଟେ enlargement of the roots, ତାକୁ root knot. They cause this enlargement in the roots, which is termed as galls, ମାନେ tumorous growth ଭଳି, GALLS. So it is caused by the root knot nematodes. Then burrowing and lesson nematodes, these they are migratory, they merge, they live most of their life, including hatching and feeding, inside the roots, and sometimes inside they can migrate from one root. They cause root rot, which is a general symptom. Root rot mane sampurna bhabare tissue destruction of the root occurs. There are then foliar nematodes. Foliar nematodes, these nematodes, they actually foliation mane hochi jo patra tar phulor pakuda. So foliar nematodes, they affect the plants especially in the leaves. So entire life cycle of this parasite is completed in the limbs. So leaves hଉଛି na, leaves ରେ photosynthesis haba. So if the leaf is destroyed, stunted growth haba. So symptoms hଉଛି stunted and deformed plants, discoloration haba, drying of the leaf tissue haba. Uh, এই যে nematodes which are responsible for তাকে foliar nematodes, because they affect the leaves and the petals of the flower. Then seed call nematodes, so fruit hobo tar seed taku semane feed, and the parasite continues to and eventually kills the seed to form a blackened cockle. তো seed call seed taku নষ্ট করদা, seed নষ্ট হয়ে গেলা পরে কোন continuation হবনি না, সেতুরু ସେ ଗଛ ଆଉ ହବନି। stem and bulb nematodes, so stem and bulb nematodes mane roots ro upper portion taku kwa jaye, they attack the upper and lower parts of the plant and migrate up the stem of the plant through water films. Infective stage enters emerging plant tissue below the ground inside the host plant. They destructively feed. Destructive feed means they feed, thereby bringing about destruction to the tissues. Then how diagnosis to based on ଆମେ ଇଏ କରିପାରିବା symptoms, above ground symptoms ମାନେ the symptoms which you observe morphologically symptoms ଗୁଡ଼ିକ like yellowing of the leaf ହେଲା, normal coloration foliage ର, ତାପରେ wilting ମାନେ ଶୁଖି ଯାଉଛି କି, wilting tendency, drooping tendency, so ଏଗୁଡିକ ହଉଛି diagnosis above ground system। ଆଉ below ground symptoms ର ଯୋଉ diagnosis ହଉଛି to find the appearance of knots in the roots or galls in the roots, ଏଗୁଡିକ ଦେଖିଲେ we can diagnose whether there is a nematode parasites or not। and there is a diagnosis based on field history। field history ହଉଛି କଣ, crop field ଯୋଉଠି ରହିଥିଲା nematode parasites, if ଆଗରୁ କୋଉ ପ୍ରକାର କିଛି ବ୍ୟାପିଥିଲା କି ନାହିଁ, if previously some type of plant diseases have appeared or not, so that is called the field study diagnosis on the basis of field history। So a prior infestation by a nematode species of the crop field will probably increase the susceptibility of getting infected by the same species। ଆଗରୁ ଯଦି ଗୋଟାଏ species infect କରିଥିଲା ସେ crop field ରେ, there is a greater chance that same species will be infect again for the next crop। that is why history ଜାଣିପାରିଲେ will take a care, precautionary care during the development of this crop and till harvesting। and laboratory assay diagnosis ଆମେ କରିପାରିବା in the laboratory when you analyze the soil to find the presence of the nematodes, or ଯଦି endoparasite ରହିବ plant nematodes ତାର plant tissue କୁ ଆମେ laboratory analysis କରିକିରି we can identify the type of nematodes present। so it is a threat to definitely agricultural crop throughout the world। ତ ୟାକୁ ଆମେ ମ୍ୟାନେଜ କରିହବ, କଣ୍ଟ୍ରୋଲ କରିହବ। The best strategy ହଉଛି to manage the plant nematodes, avoiding the nematode। okay, you don't allow the nematode to come nearer to the plant, সেটা হচ্ছে best practices। so once the infection is established, তারপরে কোন the approach to manage nematode should be kept to nematode population below economic damage levels। ଯଦି once ଆରମ୍ଭ ହେଇଗଲା ତାର ଇନଫେକ୍ସନ, ତାହେଲେ ଆମେ କ'ଣ କରିବା, ଆଉ ତାକୁ କ୍ଲିୟର କରିପାରିବା, ରାଦର ୱିଲ୍ ଟେକ୍ steps to decrease the load of the damage by the parasite in different ways। then biological control ଆମେ କରିପାରିବା, natural enemy ଆମେ ଇଏ କରିପାରିବା, natural biological natural enemy। so natural predators and pathogens of the parasite nematode species can be employed to control infestation। however, growing these natural nematode enemies is difficult and expensive। so use of antagonistic fungi for trapping and parasiting nematode, we can use these natural enemies which are naturally they are against these parasites। then cultivation of nematode, hame modified GMO, genetically modified crops we can ତାକୁ ଆମେ କଲଚର କରିପାରିବା, କଲ୍ଟିଭେଟ୍ କରିପାରିବା, which are resistant to nematodes or the plants which are resistant to nematodes. So ସେ ପ୍ରକାର modified crop plant କୁ ଆମେ ଇଏ କଲେ then the nematode parasite will not impact any danger. Then biopesticides can be applied also. Biopesticides which are developed from the which are eco-friendly in nature, and they are biodegradable, non-toxic, ଯେମିତିକି extracts from neem and several other plants ତାକୁ ଆମେ use କରିପାରିବା for nematode control, which will not affect the growth of the plant, କିଛି ବିଶେଷ ଭାବରେ ତାର ପ୍ରଭାବ ପଡ଼ିବନି। ଆଉ କଲଚରାଲ କଣ୍ଟ୍ରୋଲ ହେଉଛି ଆମର ହାବିଟ, ଆମର ଅଭ୍ୟାସ। କଲଚରାଲ କଣ୍ଟ୍ରୋଲରେ ଆମେ କେମିତି କରିବା, କ୍ରପ ରୋଟେସନ ଗୋଟେ ପ୍ରକାର କ୍ରପ ଆମେ କରିବା ନାହିଁ। So rotation between growing plants that are host to a parasitic nematodes and plants that are not parasitized by them, ତାକୁ ଆମେ alter କରିବା, ତାକୁ ଯେ crop rotation. So it is a age old ଇଏ ଠାରୁ ଇଏ କରି ଆମେ ତାକୁ new practice କରିବା. It is feasible for the farmers to grow a variety of crops employing crop rotation technique. Planting a field with the same crop again and again enables the parasite nematodes to reproduce successfully. How eradicate ହେଇପାରିବ ନାହିଁ, they will go on increasing their number. So ସେତେବେଳେ ଯଦି alternate ରେ planting a non-host species ଯଦି କରିବା in between, it will interrupt their reproduction and they will increase their mortality naturally. ତାପରେ crop root destruction, ଯଦି ଅମଳ ହେଇଗଲା ପରେ after cutting the crop, so root ଟାକୁ destroy କରିବ, ଓକେ, ନିଆଁ ଲଗେଇଦବ, so that ଯୋଉ remnants nematodes ସେଠି ରହିଥିବେ they are completely killed, ଓକେ, ତାକୁ ଗଲେ crop root destruction. Then flooding, ପାଣି ପାଣି ଜମେଇ ଦବ, କିଛି ଦିନ ପର୍ଯ୍ୟନ୍ତ ପାଣି flooding କରିଦେଲେ ସେମାନେ ଆଉ ଇଏ respiration ଇଏ କରିପାରିବେନି and they will be killed. So flooding provides a long period without host plant, thus killing them. ତ ହୋଷ୍ଟ ପ୍ଲାଣ୍ଟ ନଥାଇକିରି ପ୍ଲାଣ୍ଟ ଇଏ ହେଇଗଲା, ତମେ ଜାଣିଛ ନେମାଟୋଡ ପାରାସିଟ୍ ଅଛି, ପାଣି ଛାଡ଼ିଦବ, ତ ସେ ଯାହା ନେମାଟୋଡ ଥିବେ ସେମାନେ ମରିଯିବେ। ଫଲୋଇଂ ହଉଛି ଯୋଉ ରୁଟ୍ସ ଗୁଡିକ ରହିଯାଇଛି ତାକୁ ଆମେ ଲଙ୍ଗଳ ଦେଇକିରି ତାକୁ ଟର୍ନ ଅପ୍ କରିଦବା, ଓକେ, ଟର୍ନ ଅପ୍ କରିଦବା, so that they will be exposed to the dry condition and they will die. So good sanitation practice, ଆମେ ଯୋଉ ଶୌଚ ପାଇଁ ପଡ଼ିଆକୁ ପଳେଇ ଯାଉଛେ crop field କୁ, that should not be practiced, because in order to manage soil nematodes, field hygiene ନିଶ୍ଚିତ ଭାବରେ ଦରକାର, which depends upon the sanitation, okay, sanitation. Then similarly जो field रे machinery ଆମେ ଅମଳ ପାଇଁ use କରୁଛେ, field machinery is one of the agents for dispersal of plant nematodes into unfested land. So before transferring this field machinery to different crop fields, it has to be properly sanitized. Okay, proper sanitation kale to plant nematodes guriko semane eradicate heijibe, semane killed heijibe. And physical method hochi generally employed in glass house or poly houses jyoti plant ame crop culture korche, using heat, steam and flooding to minimize population density of the nematodes. So these are the few ways by which we can control the nematode parasites. And integrated management, you just simply find the symptoms, tapare nematode symptoms ଆସିଗଲା, nematode damage କରୁଛି, collect the soil and plant tissue, ତାପରେ identify କଲା, laboratory assay କରି ଦିଆଗଲା, ଜାଣିପାରିଲେ କୋଉ nematode, identify ହେଇଗଲା species, then you determine the ସେଥିରୁ ଯୋଉ soil sample ଆମେ ତାର density determine କରିଦେଇ ପାରିବା, and then we can make out a strategy so that the entire nematode will be killed. And the last is the importance parasitic treatment and control. In all the parasite we have already gone through this control. So I treatment of parasitic disease, you need a antiparasitic drug, you need a anti-helminthic drug. So there are different drugs available. The ivermectin drugs such as ivermectin and doramectin are excellent in this regard for these parasites. Basically the helminthic parasites for to be controlled. Similarly, the drugs formulation should be within the affordable limits of the common man. So pharmaceutical drugs, most pharmaceutical antiparasitic drugs are manufactured from basic chemicals. Okay, although some are derived from microbes. So the current jo antiparasitic drugs used on human, they are initially developed for the treatment of other medical and veterinary conditions or for the control of crop pest. It was only subsequent ତାପରେ ଯେତେବେଳେ ଜଣା ପଡିଲା ତାର antiparasitic properties, then they were given they are allowed to be applied to the human being. Then DNA RNA technology ରେ ଆମେ ମଧ୍ୟ control କରିପାରିବା. Epigenetic factors are those mechanisms that regulate genetic expression. Then Kichi molecular chaperones, that means protein molecule that facilitate non-covalent folding or unfolding. So if we apply molecular chaperones which will not allow the folding, so say protein ta synthesis of folding ହେଇକିରି ତାର ଯୋଉ structural formation of ସେଟା folding allow କରିବନି, so that it will not function. Then ସେଇଥିପାଇଁ most of the proteins are targeted during the development of the drugs. Nanotechnology ରେ ଆମର ଯୋଉ nanoparticles are used to combine with some organic polymers such as chitosan to for the development of the drugs. Then natural remedies ଆମେ ଇଏ କରିପାରିବା. Natural remedies ମାନେ ଯୋଉଟା for example ଯେତେବେଳେ pharmaceutical industry ନଥିଲା, the only drugs available for treating this parasitic disease ହଉଛି natural occurring ଯୋଉ plants ରୁ ଯୋଉଟା ମିଳୁଥିଲା, natural derived from plants, animals and other substances. So ସେଥିରୁ ମଧ୍ୟ ଆମେ ଇଏ କରିପାରିବା, like gastrointestinal nematode infection ଯୋଉଟା in both human and domestic animals, ସେଟା ଆଗରୁ ଟ୍ରିଟମେଣ୍ଟ କରାଯାଇଥିଲା with turpentine, which is a volatile oil distilled from pine resin, ଆଉ male fern extract and areca nut powder ଏଗୁଡ଼ା ମିଶେଇକିରି ସେଟା ତିଆରି କରୁଥିଲା. These remedies were less effective than modern pharmaceutical and often deeply unpleasant to the patient. So ସେଥିପାଇଁ ଆଉ ତାର ଭୟାବହତା ବିଶେଷ ନଥିଲା, କିନ୍ତୁ ଲେସ୍ ଇଫେକ୍ଟିଭ ରହିଥିଲା, ତାର ଗୋଟେ ଅନପ୍ଲେଜେଣ୍ଟ ଟେଷ୍ଟ ଆଣ୍ଡ ଅର୍ଡର ରହିଥିଲା. ଦ୍ୟାଟ୍ ଇଜ ୱାଇ ଦେ ଆର୍ ନଟ୍ used, and pharmaceutical companies, they have come out with different types of drugs. So vaccine madhya use करते different types of vaccine. माने attenuated vaccine होची कौन, जो organism को ताको अकामी कर दिया गला, मारी दिया गला नहीं, अकामी कर दिया गला. They are in a living state, किंतु तार virulence टाको नष्ट कर दिया गला. They cannot cause any disease. तो ताको जदि आमे vaccine रे use करी करी vaccinate करी परिबा चलिबो. Second होची killed, the organism is completely killed. तो dead pathogen को आमे employ करिबा, ताको inoculate करिबा body रे. ଆଉ ଗୋଟେ ହଉଛି subunit. Subunit ମାନେ ଯୋଉ pathogen ର ଗୋଟେ fragment, antigenic fragment, ତାକୁ ମଧ୍ୟ use କରିପାରିବା for vaccine. Toxoid ହଉଛି antigen ରୁ ଯୋଉ toxin substance, ତାକୁ use କରିପାରିବା as vaccine. ତ toxoid vaccine ଆମେ ଯୋଉଟା କହୁଛେ, it is inactivated, ସେ toxin ଯୋଉଟା release ହଉଛି ଗୋଟେ organism, ତାକୁ ଆମେ ବ୍ୟବହାର କରିବା by inactivating it, and such vaccine କୁ କୁହାଯାଏ toxoid vaccine. And DNA vaccine is prepared by associating certain DNA fragments with the plasmid, and then control of parasitic disease, eradication, elimination, control. Eradication होची completely removal, ଆଉ elimination तामेना we have to follow through the modification, environmental modification, and cultural control. So जदि अभ्यास हमें एपटे सबु प्रकार ये करी हमें किनिबा जे नहीं, suppose in order to counter the growth of the mosquito, so it is let that breeding area, you reduce the breeding area. तापर हम भाबियो no, we have the insect repellent, we will use mosquito but we will not clear the breeding areas. Eta hochi cultural control. This is the human nature is there, so we have to follow awareness about the pros and cons of different practices has to be followed. তারপরে জিআইএস কন্ট্রোল অফ প্যারাসাইটিক ডিজিজ রিমোট সেন্সিং স্যাটেলাইট ডাটা অ্যান্ড জিওগ্রাফিক ইনফরমেশন সিস্টেম এটা হচ্ছে কোন জিআইএস কন্ট্রোল। তো প্যারাসাইটিক ডিজিজ কোটি ভয়াবহতা রয়েছে, হাউ ইট স্প্রেডস। তো সেই ইনফরমেশন ଆମେ ଜାଣିଲେ we can plan out a strategic control and the amount of drugs required to be uh, moved to that particular area সেটা আমি এখানে। তারপরে effective legislation, রুল রুলস অ্যান্ড রেগুলেশন সেটা ন কলে কেহি লোক মানিবেনি। So effective legislation is the should be laid down by organization, by the local body, by the government, by the semi-government, at the state level, district level, and the national level. So a control program can be organized through ଯେମିତି ଗୋଟେ example ରହୁଛି, they decide that yes, oral polio vaccine eight ଅମୁକ ଦିନ ଦିଆଯିବ, subsequently ଅମୁକ ଦିନ। So all over throughout the India, it is a legislation. So throughout the India, all the children under this age have to be given oral polio vaccine. So for this, they employ these DDs, and they will visit all the houses. First of all, they will bring out data. they କେତେ ଘରେ କେତେ ପିଲା ଅଛନ୍ତି ସେ ଡାଟା ଦେଇ ସାରିଲା ପରେ you require this much dose, and they will give, say particular that date has to be followed. So ସେଇଥିପାଇଁ ଇରାଡିକେସନ ଅଲମୋଷ୍ଟ ହେଇଗଲାଣି ପୋଲିଓ ଆମ କଣ୍ଟ୍ରି। ଏଇଟାକୁ କୁହାଯାଏ effective legislation for control of parasitic diseases. So okay, so uh, we have already uh, tried to completed this topic. Now, as I've told you, I will share the slides, and for this block 4, I'll prepare the slide within a couple of days, and definitely I will share you. I give you words, and if I get an opportunity, then only I can share. If I get an opportunity, means if you give me the number where I will share it, or any this thing mail ID, I will share it with you. So, any doubt or any your my number. So again, I tell 94371 96322. This is my number.
Sir,
9437
sir, ଆଉ ଥରେ repeat କରନ୍ତୁ sir ଟିକେ।
କରୁଛି repeat କରୁଛି 94371
9371
96322.
96322. Okay,
Yes.
sir. Thank you, sir.
Okay, this is my WhatsApp number. So anytime, whatever you require any help from me, so I'm there to help you. Okay. So
Okay, sir.
let's end today. Thank you so much.
Thank you very much, sir.
Okay.
Thank you, sir.
Okay.
Thank you, sir.
Thank you, sir.
Thank
you,
you
sir.
all for your cooperation. Okay. You have given a patient hearing. Most probably day after, on Monday, I will these two slides I'll share it tomorrow, and on Monday the today's somatic parasitic nematodes I will share this slide with you. So let's depart now.
Okay, sir.
Okay, thank you.
Sir, namaskar, sir.